My name is Jennifer Phillips, a nurse practitioner student. This is Megan. She is a 32-year-old female who's going to be helping out with the ear, eyes, nose, and throat assessment. First off, we're going to start with the Snellen chart. I'm going to check your vision with your corrective lenses on. So I'd like you to cover one eye at a time, and I'll go choose a line, okay? Okay. All right, cover your left first. Okay. Can you read line 7 for me? FELOPZD. Okay. Those are all correct. Can you read line 9? LEFODPCT. Okay, go ahead and cover your right eye. Let's do line 8. DEFPOTEC. And let's go ahead and do line 9. LEFODPCT. All right, so now I'm going to check your gaze. So I want you to follow the tip of this pen light in the direction, okay? Okay. All right, there's no nystagmus. It was fluid movement from each field. Next, we're going to check out, I'm going to have you remove your glasses for me. All right, so we've got evenly distributed hair growth on our eyebrows. We've got full lashes on top and bottom. There's no drainage. Everything looks clear. Conjunctiva is nice and pink and moist. Nothing wrong there. Okay. Let me check our lacrimal glands. No drainage and they are present. Next thing we're going to do is I'm probably going to look in your eye. Let's go ahead. Grab this. Turn it on, and then we'll dip down a little bit. Okay, so for this, I want you to look at the light for me, okay? I'll take my glasses off as well. All right. All right. Look at the light. Okay, we did see that red reflection in the light, so that's good. Next, I'm going to get close to you, so just pardon my reach. I'll put my hand on your head, okay? And I want you to stare at a fixed point on the wall in front of you. Okay. All right. We've got a nice orange-red color. We've got some blood vessels that are nice and clean. Macula and optic disc are present. Okay. Now I'm going to go to your other eye. So if you'll just keep on that fixed object across the way. All right. Nice and orangey red. Blood vessels look good. Macula and optic discs are present. Okay. Turn that off. Now what I'm going to do is I would like you to open and close your eyelids for me. Good. Awesome. Nice and even. Now I'm going to go ahead and put this right in the middle, so just stare straight ahead at me. Okay. Both pupils react evenly. Next I'm going to check one at a time, okay? Went from about a 4 to a 2. And a 4 to a 2. Good, nice, round, equal reaction there. There's no nystagmus again. Now what I would like to do is we're going to go ahead and look at the ear. For this, I'll be using an otoscope. First off, I'm just going to inspect your ears. Any tenderness to your ears?
No.
No? Okay. Ears are symmetrical, they're clean, they're dry, there's no drainage, there's no lesions or sores. I'm going to go ahead and look inside and take a look at your tympanic membrane. I'm going to pull on your ear just a little bit, just let me know if it gets uncomfortable. The canal is nice and clean, there's very little cerumen on the tympanic membrane. It is nice in a pinkish gray color. I do see the handle of the malleus and the reflection of the light. There is no redness or there's no fluid present behind. I come to this side and do the same. Just let me know if this is uncomfortable. Okay. Very little cerumen, again, nice clean ears. More gray on this side of her tympanic membrane. I do visualize the malleus, and I do see the reflective cone of light. Okay. Next, we're going to test your hearing, okay? So I'm going to use this tuning fork. I'm going to put it on top of your head. I'd like you to tell me if you hear it on one side of your head, like your left or right ear, or both at the same time, okay?
Both.
Both? Good. For the next one, I'll be putting it next to your ear, okay?
Okay.
Let me move your hair out of the way. Stop that. Okay. We're going to go ahead and do the left ear first.
Okay.
Tell me when you can no longer hear it.
Okay. I cannot hear it.
Okay.
I can no longer hear it.
Awesome. Okay, let's do the next one.
Okay. I can no longer hear it. I can no longer hear it.
Okay. Now what I'd like you to do is to plug your ear with what's called your tragus right here.
Okay.
And I'm going to whisper 3 words and you repeat them back to me.
Okay. Fun, fun, fun.
Fun, sun, bun.
Oh.
Okay. Let's try this side.
Car, star, bar.
There you go. I like to rhyme. I can't help myself. All right. Next, let's do your nose. So first, let me palpate it. Move your glasses up for me for just a second. I told you to put it back on, but I lied, didn't I? Okay. Nose is nice and symmetrical and even, midline. Anything tender?
Mm-mm.
No. There's no lesions, no swelling, and there's no drainage currently. Let me turn on the light here. Okay, go ahead and tilt your head up for me. Nose has a light pink and then it goes up into a dark pink, but she does suffer from allergies, seasonal allergies here in Oklahoma, but there is no drainage currently. All right. Let's check your sinuses here. We'll do this one. You let me know if it's tender at all.
Okay.
Any tenderness when I'm pushing?
No.
Okay. Next, we're going to inspect your mouth. All right, so they're on the lips. They're symmetrical. There's no lesions. No, they're not dry. They're moist. Okay. So what I'm going to have you do is open your mouth for me. Okay. All right. Buccal mucosa is moist. There's no sores, no lesions. Go ahead and lift your tongue for me. The tongue looks good and moist. Tongue down for me. And I'm going to go to the side. No lesions. No lesions or sores. Okay, and open wide. And then tonsils have been removed previously. Everything is nice and pink and moist in there. I'm going to check your gag reflex. So. Got it. Let's see what else we can do to torture her. All right, so I'd like you to go ahead and stick your tongue out, and then to the side, and then that side. Okay, and one more look so I can describe your palate. Hard and soft palate, don't have any lesions or sores. It's like nice pale pink. They're moist. It flows in there, and then your uvula, go ahead and stick out your tongue. Is nice and pink, and nothing abnormal about it. There doesn't seem to be any drainage in the back of your throat. Okay. Thank you, Megan, for helping me today.
You're welcome.